بخش شکر و چاقی. امروز میخواستم امرایتان گپ بزنم درباره دس کنسالتینگ که یک کلینیک است در نمبر 9 فلیتوود درایو در نری وارن. در فلیتوود درایو کسایی که شکر داره خودم اونا رو میبینم مرض شکر یا چاقی باشه، خصوصا حالا که وقت زمستان است زیاد مهم است که واکسین فلو انجکشن تانه بگیرین. در دست کنسالتن خودم میتونم که کسی که مویایشان بره یا تکلیف جلدی داشته باشه اونا رو من میبینم. امرای من یک چند متخصص دیگه هستن که از پلاستیک مانامت جراحی و پلاستیک، از ارتوپیدکس کسایی که مریض استخوان چیز داشته باشه، رقم زانوی درد داشته باشه یا سورینت یا کدام تندن کدام جایی که درد داشته باشه متخصص اوناست. یکی دیگه اسپشیالیست است که متخصص کسایی که هرنیا داشته باشه یا که اپندکس چیز شده باشه اونا رو میبینم. دست کنسالتینگ یگانه کلینیک است که نفرای کرونیک دیزیز میتونیم ببینیم، نفرای استتیکلی رقم اگر کدام کس بخواه که نفر پلاستیک سرجن ببینه که اسکین کانسر داشته باشه یا یک چیزی روی خودم میخواه که تبدیل کنه میتونه که در کلینیک بیاین. در کلینیک ما چی داریم؟ آیوی انفیوژن، رقم فلوید که در رگ تیر میشه، کسایی که اگه آهنشون کم باشه یا تکلیف آستیوآرترایتیس داشته باشه یا جاندردی قسم داشته باشه میتونن که بیاین انفیوژن بگیرن. انفیوژن مانا میده که هر دوا که کارشون باشه باز امور در رگش میتونی که تیر کنی. در دست کنسالتینگ بوتاکس و فیلرز هم شروع میکنیم. اگر کس میخواست که بینی خود جور کنه بعد نمیخواد که سرجری داشته باشه، میخواد که بوتاکس یا که فیلرز جور کنه میتونن در اوج زنگ بزنن. در دست کنسالتینگ کسایی که انال خود خواسته در ورک کور هستن یا TAC اکسیدنت چیز کرده باشه بعد نمیتونن که در انگلیسی که وکیل گپ بزنه. که یک لو فرم بسیار خوب کار میکنیم، نامش زپارس هست. اونام امروز امرایتان گپ میزنه، نامش تیم جکسون است. بعد اگر کسایی که نمیتونن که در انگلیسی که وکیل گپ بزنه در اوج یک همشیریم هم هست نامش تامین است، میتونین در کلینیک زنگ بزنین یا در زپارس لو فرم زنگ بزنین، امرایشون گپ بزنین، تکلیفتان رو بگوین که چی پرابلم است براتون کمک شود. بعد در دست کنسالتینگ هر کس که تکلیف چاقی داره یا تکلیف شکر داره میتونن که بیاین کدی رفرال از پیش جی پی یا بغیر از رفرال از پیش جی پی. امروز یک کلیگم از اینجا نامش نمال است، اینا پلاستیک سرجن است. هم در پابلیک کار میکنه هم در پرایویت کار میکنه. Namal, can you please introduce yourself?
Thank you. Hello everyone. My name is Namal Munasinghe. I'm a plastic and reconstructive surgeon. I work publicly in Monash Health and Frankston. Monash Health means I work both in Dandenong and KC Hospital. They're all public, and in private I'm operating at Margaret Private Hospital and St. John's Barrack Hospital. That's all about my workplaces. And then my work include, as my name says, is plastic and reconstructive. That includes both clinical and aesthetic work. Aesthetic work basically make you look pretty. And there are surgical and non-surgical ways of doing it. As Shabna mentioned, it's Botox and fillers that can be done in the clinic setting. And then some of the aesthetic work can be done in the clinic setting too. However, there are procedures that needs to be done in the hospital setting. All the aesthetic work can only be done in the private hospital setting because it's not funded in the public sector. And the clinical work, I mainly do a lot of skin cancers and then excision of them, and once it is excised, and then closing the wound with the grafts or local floods. And if any bigger complex reconstruction needs to be done, I perform them in the hospital. It can be both public and private hospital settings. And hand surgery is a wide variety of procedures I performing. The broken bones in the hands, or the cut tendons and nerve reconstruction, and then fingertip injuries, and they include both accidents happen covered by the THC and also the workplace injuries too. There are procedures can be done in the clinic like carpal tunnel. It can be done under local anesthetic safely in the rooms, but there are patients who prefers them to be done in the hospital. Then I can direct whether to be done in the public or a private hospital setting. And in addition to hand and the skin cancers, largely I perform breast reconstruction. Breast reconstruction means whenever someone has a breast cancer, when the breast is removed, we make a new breast, either from their own skin and fat, mainly coming from the tummy, or implant-based reconstructions. And also the aesthetic breast, that means either increase the size, we call it breast augmentation, or if the breasts are large, we reduce the size to their satisfactory level. In addition to those, I also treat kids. Kids have certain plastic issues like scar management. Whenever they have trauma, it heals with the scar tissue. Sometimes they are not looking better, so we revise the scars. Sometimes they can be treated with steroid injection that can be done in the clinic setting too. But if they are large, that needs to be removed, it has to be done in the hospital. And also they have condition called back ears. That means the prominent ears, that ear is sitting more to the side than the forward, and then we place them in the appropriate place. But that has to be done probably when they're going to the school, not so early, because they are still part of the development and they get auto-corrected. I think I pretty much cover most of the procedures I do, but if you have in doubt, you always can come to the clinic and then have a chat with us or with Shabnam, and then we can go through. For all the clinical work, you need a referral coming from your own doctor, because that's part of the Medicare. But for all the other aesthetic work, you don't need any referrals. You just can bring the clinic and make an appointment, and then we can see you. And especially we don't have a waiting list at all, because we are just starting fresh. You'll be seen very quickly and you will be treated very, very quickly. Thank you.
Perfect, thank you. And I'm just going to forward to Tim Jackson. So he's one of the lawyers. Jak lawyer ste از پاریس law firm که کار میکنه. امروی کلینیک اینا کار میکنه. So کسایی که اگه hand injury داشته باشه، let's say work cover، دستش اوگار شده باشه یا ناخونش کت کرده باشه، شکسته باشه، نمال میتونه که براتون جور کنه. بعد اگه فکر کنه که کدام work cover کیستان است که نال اینجوریش 80% بالاتر است، باز اون وقت میتونیم برای تیم جکسن یا بر تامین رفرال روان کنیم. اینا هم نفرای کلینیک، مریضای کلینیک تو ویتینگ لیست نداره. همون ساعت که زنگ بزنیم سبا دیگه سبا براتون اپایمنت جا میکنه.
Thanks, Aaron. Thank you. My name is Tim Jackson. I'm from Japan. It's such a pleasure to be working with such a really great medical group and a new medical group to make sure that their patients and our clients can have the absolute best outcomes possible for them. One of the things that we want to do really from the start is making sure we get that work cover or TAC claim form correct. If we can get that form correct, then the treatment and surgery you might need can be done quickly and easily, and hopefully that means you can get back to work and get back with your life and be able to provide that food for your family on the table. But if you can't, then we're there to assist you to do compensation claims, which can range from very small claims to very significant claims in excess of $1 million if you're really badly injured. But the first point is always to come to us to get that claim form done. We will see you free of charge within a week, within a day if you really need to see us, to make sure we get that first form right so that your claim is accepted. And that's the most important thing, because if your claim's not accepted, it can take months and months, if not years, to get your claim accepted. Meanwhile, you've not been able to access any of the treatment that you really, really need. When you do access that treatment, you're treated like a private patient. So as Manal said, you can go to them and see them straight away. There's no waiting list for those private procedures. You can see them straight away and get those procedures done nice and quickly to make sure it's done quick and easy and under really good care as well. So that's sort of about me and the firm and sort of what we can offer as lawyers in both TAC work cover, but also public liability, areas like superannuation. Most people have insurance built in their super that they don't know about. You've been paying it every week while it's been in your superannuation fund, but you don't know about it. So there are all sorts of things that we will look at for you when you come and see us straight away to see what can we access you straight away. We also do have some great staff members that speak your language. So we do have people that can speak Dari if you need, and all sorts of languages. We speak about 20 different languages at the firm. So we're really proud to have a diverse cultural background at the firm to make sure that we can sort of speak your language when you come to see us. If we don't have someone that can't speak your language, when you do come and see us, then we'll have an interpreter and we get that interpreter straight away. The other really most important thing is when you come to a lawyer, often you're in the hardest point of your life. You need some guidance. So when you come to see us, there's no cost to come and see us. It's absolutely free for your first consultation. We'll sit down with you, we'll talk you through what the journey looks like for you, how long it's going to take, and the likelihood of success. If at that point we don't charge you anything, we give you the advice absolutely for free. And then we don't charge you anything throughout the life of your claim. We don't ask you to fund any reports costs. We don't ask you to fund any court costs. We don't ask you to use any sort of credit providers to pay for them. We simply will fund them out of our own pocket, out of our own bank account, to get all the necessary material we need for the client's case. At the end, you only pay us if you win. And we're proud to cap our fees as well. So we cap our fees at 15% plus GST to make sure that patients and clients, when they come to us, you know that you're not going to lose all your compensation to legal fees, and you know that by doing it, there's going to be something there for you, and that's the most important thing. Of course, we're there to help along the journey, but we want to make sure we can put as much as possible back into the client's pocket that we can. So we're really proud to work with you and your team, and we look forward to what a great clinic it's already started out to be, and wonderful things this clinic is already doing, and beautifully renovated, great facilities, easy parking, which is never easy when you go to a doctor often. Parking's the hardest thing, I can tell you. It's got great parking off the main road, so really easy to find. And you'll see a great warm reception team when you come in, and you have lovely doctors and warm doctors. And the other thing really for me, knowing that my clients are coming to see you, is that you offer a range of services. And for clients and patients, that's really important, because as a client, you're already injured. You might have a wrist injury, or you need some carpal tunnel surgery. The last thing you want to do is go from one doctor to another referral, to another doctor, to this doctor, to this doctor. So they have a great multidisciplinary team there, and that's really important. So thank you for the opportunity. We look forward to working with you as we have been, and looking after your patients and our clients for the future. So thank you.
Thank you. So thank you for both of you guys for being here. The benefit, as Tim mentioned, being at Desi Consulting, we look after the patient holistically. So if there's something, if I get a referral and I look after someone's diabetes or weight, and I see that they need, they've got chronic knee problem, I can easily refer them to one of my colleagues, Darren Webb, who's an orthopedic surgeon. We can do plasma injections, we could do so different types of infusions, just to assess that patient holistically. But if we get a patient where, like I said before, they've been injured at work and work cover is a bit complicated, we don't know how it works, so that's why I work very closely with Tim. So I could just give him a call and say, hey, I've got this patient, can you please sort it out? So it's looking after the community in a holistic manner, and we try to take as much of your stress and burden away from you and providing like a one-stop shop. So if you guys need any questions, if there's any topics that you want to learn more about, please just give us a call at Desa Consulting, or you can see us on visit our website, which is desaconsulting.com.au. But under our information, we will the best other benefit, we don't have a waiting list at the moment. You can come in yourself, or you can get a referral from your GP. Just call the clinic if you're unsure. We can organize all of that for you. کسایی که اگر از خاطر کرونا ویروس بودن اونا وزن زیاد گرفته، اگر وزنتان زیاد است میتونید که در کلینیک بیاین برای ویت لاس پروگرام. یک دانه ویت لاس چالش داریم که بر 8 هفته میره. اونا میتونه که خود ما ببینه هفته درباره غذاش گپ میزنم، درباره مدیکیشن اگر کدام دوا کار داشته باشه، بعد با هم که چی کار میکنیم. منتل هلت کانسلر کنال سعی کنه که چه رقم کمکتان بتونه که ریلیشنشیپ تا که نان خوب کنه. رقم نمیتونی که بوی اینی نان نمیخورم که چاقم میکنه. باید خوب ریلیشنشیپ داشته باشی بر غذا. زیاد مهم است که اکسرسایز کنین. سو اکسرسایز فیزیولوژیست در کلینیک است که کمک میکنه بر اکسرسایز. یگان مریضان کنال 50 کیلو یا 25 کیلو وزن که ببازن، اونا یگان وقت جانش کم ذره کشال میشه یا خلطه، روش ایجش کم ذره کشال میشه، شکمش یا زیر قولش. اونا رو میتونیم که رفرال بدین برای پلاستیک سرجن که ریکنسترکت کنه. سو یگان کس کمک ذره فت داره در شکم خود یا در بغل یا در زیر قول، اونا رو میتونه که لایپوسکشن کنه. که بعد از لایپوسکشن یک پروسیجر است که میگه بادی کانتورینگ. سو کل بادی تا میتونه که کانتور کنه، پس اما تو کرویچه و چیزا رو پس جانتان بیاره. ویت لاس بر چی مهم است که اتکل ما باید وزن ما صحیح باشه؟ از خاطر at the moment Australian government system زیاد پیسش در obesity related diseases میره. رقمی که اگر وزنت زیاد باشه 100% دیابتیز میگیره، یا تکلیف فشار یا تکلیف قلب، استروک. از او خاطر بسیار مهم است وقتی که کس که وزن میگیره بیاین یک کس ببینین که وزنتان رو سر کنه. اگر در کلینیک بیاین که خود ما ببینین، اگر financially problem داشتین نمیتونستی که فیس بدی، اونا رو میتونیم که با بیل کنیم در کلینیک. بعد obesity management بسیار امپورتن است که type 2 diabetes نگیریتانه. سال یک دفعه زیاد مهم است که fasting blood test کنین. blood test ما رو میتونه خونه چک کنیم برای کلسترول، برای شکر، برای kidney function، آهنتان چه رقم از B12، چه رقم از مگنیزیم، چه رقم از اونو رو که چک میکنه. نال یک دانه گایدنس میده که این جان آدم چه رقم فانکشن میکنه. وقتی که او پاتولوژی رو که بگیریم میتونیم که تریتمنت پلان برای جور کنیم. based on that treatment plan که نال چه رقم دوای تا چینج کنم، یا چه رقم اکسرسایز باید کنی، یا چه رقم غذا بخوری. For example اگر انسولین فاستینگ انسولین لول کدام که از بالا باشه، از 25 بالا باشه، رقم دایت که ترای کنی، رقم که رژیم بگیری، نمیتونی که وزنت کم شود، از خاطر که پنکریاس فانکشنش صحیح نیست. سو برای اونا بسیار مهم است که بیاین در کلینیک تنها یک چکاپ کنن. اگر کدام چیز ضرورت باشه براتون میگم که اینی پروگرام میکنین یا اینی دوا رو بگیرین که کمک براتون شود. کسایی که شکر داره یا کسایی که تکلیف قلب یا فشار داره، اونا میتونه که در کلینیک زنگ بزنه برای فلو واکسین، government funded فلو واکسین میتونه بگیره. بعد کسایی که شکر داره زیاد مهم است که واکسیناش اپ تو دیت باشه، خصوصا تتنس باید هر 10 سال بعد شوه. بعد کسایی که شکر داره بعد از اونا زیاد مهم است که هر سال فلو واکسین خدا بگیره، کووید واکسین، واکسین های دیگه خدا. fully fasted blood test که یوران ادرارتان رو باید تست شود که سعی کنیم که اگر بوره در ادرار است یا پروتین گردایتان باید فعالیتش چک شود. باز اونا رو که چک کنیم برای تریتمنت پلان جور میکنیم. based on that treatment plan تریتتان میکنیم. بعد اگر هر سوال چیز داشتیم میتونیم که دست کنسالتنت زنگ بزنیم، خودم امرایتان گپ میزنم یا اپایمنت جور کنیم در ریسپشن بیاین ببینید.
You've just sort of heard about obesity and having treatment and surgery for that, but what a lot of people don't know or realise is often the TAC or work cover can fund obesity treatment for you. Often, as we know, when you've injured yourself, whether it's your wrists or your back or your knees, that means you can't be as active as you once were. You can't chase the children around the yard, you can't sort of go to the swimming pool or the gym, which you would do on a regular basis. And unfortunately, this means that your body isn't going to process the food that you're eating as quickly. And often I see in work cover or TSC, unfortunately, these people put on some weight. And what lots of people don't know is that the TSC and work cover can actually fund that. They can fund that obesity treatment for you, fund dietitians, fund medication, fund surgeries. I've had lap band surgeries approved before as well, because a work cover accident won't just affect your back, it's going to affect your entire body, it's going to affect your mental health. We heard before that they've got a great counselling team there as well that you can see as well. So we've got a counselling team, a decent consulting that you can see, because these injuries have such a big impact on your life that it's very normal to feel down. Your world has been changed significantly, so make sure you do seek that mental health. It's really, really important. Now, if work cover or the TAC ever decide to say they're not going to fund something, that's not the end of it. And we need to be really clear about that, because these insurers unfortunately know that lots of people aren't going to dispute things. Lots of people are just going to go, oh well, they said no, I'm not going to try anymore. And that's not right. If you need the treatment, then they should be funding the treatment for you. So with work cover, you've got 60 days to lodge a dispute about any treatment that the work cover has decided not to fund you. Now you can do it outside those 60 days. So if you're sitting on something at the moment at home where they've not funded your back surgery from 2 years ago, or they've not funded your medication from 3 years ago, that's okay. Come and see us. We can try and get that treatment funded and that medication funded for you. If what we do is we send you off to an independent conciliation, it's like a mediation, where we go there and try and resolve the matter for you. If we can't though, you've got a couple of options. You can go to a panel of independent doctors, and that independent panel of doctors, called the medical panel, will decide whether you need that treatment or surgery, whether that treatment or surgery is necessary. Or in most cases, we'll take your case to the magistrate's court. That's where we'll take it to a judge, and we'll take all your evidence, and that's where we can get reports from your treating doctors about why the surgery is necessary and why the accident has led to your increase in your weight or your depression or the need for a certain medication. And then we can fight your case at the magistrate's court in front of a judge and make sure we can get the right treatment for you. With TAC, it's a little bit different. With TAC, we once again can dispute it, and absolutely should. We then, after we dispute it, we'll get reports to support that decision that you do need that treatment. And after we get those reports, what we're going to do is we're going to sit down with the TAC in a conference to try and convince the TAC to change their mind. Now, thankfully, these are very successful at the TAC. I'd say you succeed more than you lose these ones at the TAC, so they're really worthwhile. And often, for example, we often see it about physiotherapy treatment or hydrotherapy treatment, the TAC, or counselling. The TAC will say, well, you can have 12 more sessions and then that's it. You can't have any more ever again. And one thing we can do at those conferences with the TAC is say, well, give that person the 12 sessions that they need, but don't cut them off forever. Let them come back if they need more and ask for more, and that's really successful. TAC is really strict though. If you have a TAC decision where the TAC said, no, we're not going to fund it, you only have strictly 1 year to do something about it. So don't wait with the TAC. If you've got something at home like WorkCover, but even more important with the TAC, come and see us straight away because you've only got 1 year to dispute it. Otherwise, you're stuck with that decision for life. And it's really harsh on some people to be stuck with those sorts of decisions for life. If we can't change the TAC's mind, a bit like WorkCover, we head off to VCAT, which is a court tribunal, where we argue in front of a tribunal member once again why that treatment is necessary. So you can go to Decent Consulting for lots of treatment and lots of options. If your medical team recommends that treatment, but the insurer is saying no, please come and see us. We'll work with your doctors, with us to make sure we can get that treatment that you do need and deserve, and hopefully you can get your life back on track.
Yeah,
Thank
that's
you.
really good. Thank you.